Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you.
Welcome back to another episode of Let's Talk About the POTS Life.
Today we are going to talk about a topic I feel like we talk about a lot in the app and different questions about it or, kind of feedback about it, but we haven't really talked about it on the podcast, and that is all things tilt table.
Yeah, I feel like
it is.
Yeah, it's like a common question you get when someone reaches out to do a consult, like when you're not sure if you're diagnosed yet, you're listening and you have some symptoms.
Correct.
And then they have questions about what is this tilt table test and where do you get one?
Where do you get it? Do I need it? What is that really going to tell me? All the things.
Yeah, absolutely. So we're going to start off with what is the tilt test?
Yes. So the tilt table test is typically prescribed either by, most often, a cardiologist, but other times it'll also be by your PCP can order it, something like that. I would say at least in our area, the Pittsburgh area, surrounding areas, that's who orders it.
The PCPs.
PCP in cardiology.
Which is good that if you're just working with your PCP, you don't have to wait to see a specialist like a cardiologist. If you talk to the PCP and explain it, that is helpful.
And especially because in a lot of these places, it takes so long to get the tilt table even run. So for here, just like, speaking for the Pittsburgh area, I had somebody in today and hers was like 3 months out. I've heard longer, and it also depends on your availability, when they have cancellation.
Right.
So it is a couple months. And I think what's nice is if your PCP orders it, then you can also work on getting into a cardiologist, getting into the specialist. The doctors out of Cleveland Clinic, neurology, orders it and they handle it. So it really just depends on your area. But I think whoever you can work with who feels like we can get this done or at least get the order and get the ball rolling, the sooner the better, because it does take a while.
Because if you then had to wait to see a cardiologist to get that script, that could take, getting into a specialist sometimes takes months anyhow. If your PCP could at least put the order in for you, if it takes 2 months, you could still maybe see a cardiologist in that time frame to maybe help connect some more of those dots while you're waiting for that tilt test.
Right, because my ultimate goal is when I'm talking with others that, when they ask my advice, I want you to see cardiology.
Yeah.
I want you or to see a PCP who is knowledgeable to roll out all crazy things.
Yes.
You should have the echo. You should have an EKG. You should have blood work. We want to make sure when we are diagnosing POTS that we are confident.
Yes.
Instead of just throwing anything at the wall and hoping it sticks, that you have ruled out all other things. And then you're like, okay, no, POTS is making sense. And now let's look at how to move forward, whether that's a tilt table. In most cases, I would say it still is. But there are some, and we'll talk about that later, instances where people don't use tilt tables. But I would say still the gold standard is the tilt table. And many of the larger universities that are these POTS clinics are, in fact, using tilt tables.
And the reason that you might get a referral to cardiology from your PCP is because it's related to the heart. And
correct.
So they want to make sure that they're not skipping over something that could be much larger and time sensitive, a ticking clock essentially.
Yes, I mean, you want to make sure it's not any type of regurgitation of the heart or an issue with the valves or a heart rhythm abnormality. You want to rule all of those things out. I saw, I believe, on Dr. Nance's thing, and it said little miss normal instead of little misdiagnosed. And it's so true, because the ultimate goal is all these tests, the blood work, the EKG, the echo, they all come back normal.
Right.
And I've been there. In a big picture, we want that. When you're going through it,
you don't
feel
love
horrible.
it.
Yeah, when you feel terrible, you hate that. It's all part of it. A friend of mine is actually scheduling her tilt table test, and she sent me a message today and was like, well, blood work was fine. My echo was fine. I stopped the medicine she thought might make me dizzy, and now I have to get the tilt. And again, it's frustrating. It makes sense, but it's still just, we're all looking for that like quick answer, quick fix. I mean, we'd all be lying if we weren't.
I mean, and it's for the best that they're ruling out these things, and things like your echo are coming back clear. That is a good thing. I know it's demoralizing at the time because you want to be like, okay, I want to figure out what's wrong with me. I want to get better.
1,000%.
But you want those to come back normal.
Yeah, because if it was something like that, that's something bigger.
It's a much larger,
something else being wrong. So no, 1,000%. You just want to roll all the crazy things out so then you can go have your tilt table. And once you get that scheduled for that tilt table, that's a whole nother animal in itself. And I will be 100% honest. I was so clueless going into mine. I had Googled what they do. And what they do is you lie on a bed and you are strapped to the bed, and you have, again, this is not a end all be all with all.
Right.
There are different hospital systems that do different things, but from my situation was I had an IV in the right arm, and then I had you're laying down, arms out to the side. I had an IV in my right in case I had to get fluids or something like that. In the left side, I had my blood pressure cuff, and I was hooked up to my EKG, and you have your pulse ox, and then you lay flat for an amount of time, and then the test starts, and it is slowly moving you up from a lying position to a full standing position. And I didn't think it would feel good. I knew that. But I was not mentally prepared for how terrible I actually felt.
Really?
Oh my gosh. Because I think I was adjusting or disguising maybe how I felt. Because compensating is probably the best word. I wouldn't stand still in a certain position for so long. I would move my legs, or I would sit in a chair and adjust, or I would,
and you can't do that during this.
You're locked, and that's the point, because you are not using your muscle pumps and your calves and everything. So that blood is allowing which on purpose is pulling to your feet to see what the response was. And I have heard many stories of people actually having syncopal episodes and passing out during their test. I did not, but I sure came close. And what happens is every so often you feel the blood pressure go. They're constantly taking vitals. They're constantly monitoring. I had a nurse that was in there with me the whole time, and then my physician, not my personal physician, but a cardiologist, was circling and here and there.
Monitoring it.
Yeah, I did get through the whole test, and he came over and he said, okay, it's POTS. I had passed my heart rate. I can't even remember the numbers, but it went up significantly. To meet diagnostic criteria, if you were over 18, you need to go up a sustained 30 beats per minute to reach the POTS criteria. And you have to have, your blood pressure staying relatively the same. It will move a little bit, but relatively the same. And he got his phone and he said, I'm going to let your doctor know that, that's what it is. And I was like, okay, great. And she brings you back down and you lay there. And I think I was running on adrenaline because, one, that's the only way I was staying up. And two, I was like, great, okay, I have answers and whatever. And then the next few days it was the gift that kept giving. And I was so not prepared for that.
The one nice thing of all that negative that you're experiencing is that you get instant results.
So I don't know if that was just me, because
that's not typical.
No. So he knew my physician, and I think also me being in healthcare maybe helped.
Yeah.
He personally knew my doctor. So it was right then and there, and we were talking about it. Feedback from others is they don't typically know, or they have to wait till it gets in their results. Plus mine was also 5 years ago, so tilt tables weren't used as much. I mean,
right.
POTS was still around. It wasn't that, but I just feel like obviously post-COVID,
things are a little bit different.
Tables are being used way more because I think we're just seeing more and more.
Right, because we know that more long COVID individuals are developing POTS as a result. So sorry, it's not instant.
No.
Possibly.
I think it depends where you go, but at least I know my clinic site, people that have gone since, they don't know right away.
They don't know right away.
No.
I was hoping that was like the silver lining. Like, okay, Kelsey's saying you lay there, it's terrible, you're strapped to this board, you might pass out. But at the end, silver lining.
It was for me, but no. And also mine didn't take that long to come back, like formally in the chart, but I think it takes a little bit for people.
Because I guess too, it would depend on who's there during the tilt test. Because then if it's someone else needs to review those results, it might take a little bit longer.
And I don't know how, obviously we have our two major health systems in Pittsburgh, but like how one is versus the other.
Right.
I don't know if it takes longer or, you know, how that all looks. But no, I guess it was a silver lining for me that he was like, you have POTS. And I'm like, great. Now what? Yeah, now what? And what happened is at that time, I was still having PVCs. Sitting in this seat, I understand that obviously created so much adrenaline.
Right.
That obviously overfilled my cup. And I should have known within 48 to 72 hours the world was coming crashing down. But here's me. I have no idea. I'm like, I have POTS. I go out to my husband. I'm like, she says I have POTS. And he's like, okay. And I couldn't find any normal after that.
For the next several days.
No, I couldn't get my body to regulate. I had high heart rate. I had, you know, all of those things, nausea, GI, headaches, all the POTS symptoms were just, you know,
amplified. After that.
Mm-hmm. They were really like shot out of a cannon.
Would there be any way that folks listening could do something before the tilt table test or after to maybe help with those symptoms?
After, I think what I would do is hydrate, because I didn't know. I didn't know what I should hydrate with. I didn't know how to like lower that adrenaline, and hopefully by people listening to the podcast, they have a better idea of like how to.
So we've talked about hydration a lot.
Yes, hydration and electrolytes and getting your food and timing and all of that. Basically doing all your tricks just
to make sure that your symptoms could be, because you're going to have them.
Correct.
Is what we're saying. They're going to happen.
The only thing, and I've heard, this is not medical advice, but I've heard from many of you, and I think I would be the same way, so I'm not against it. Basically, it's like you want an answer, right?
Yes.
And you know you have these symptoms. So people are probably not overhydrating
beforehand.
Because, you know,
you don't want to risk anything that's going to
mask.
Yeah.
Right.
Your symptoms.
So it's basically like, my theory is if it stinks all the time, let it please stink on that test.
Yeah.
So I think prior to, no, you can't do it. Like, there's nothing to prepare you, because the ultimate goal of preparing prior to would lower the adrenaline and increase the blood volume, which would then show
less of a severe change
of your symptoms,
which might get you not on that target.
I've heard all kind of crazy stories that people do prior to their test.
We might have to search out an expert to help explain it, if that is true, if that is a real thing that you should not prepare for it, or if it really doesn't matter at that point, because you're not diagnosed, if you need medicine, you're not on it yet, you're not doing a program.
I mean, they do, if you were on a beta blocker and it's something they try prior, like you have to be off it so many days. So there are certain meds that they're like, no, come off, because I think it's the way of the medical system too, saying like, well, if it's going to stink, like let's
see what you are at baseline without any kind of intervention.
Yes. So they do to a point, but I've heard people, they're not hydrating before. But then you also, that's a slippery slope. And this is where I say like, okay, don't dehydrate yourself, because if you also are not, if you take it too far the other way, then you're going to see a change in your blood pressure, which will then also pretty much discount the whole test, because you're not allowing your body just to go in there and do what it does normally. So I say just try to live your normal day to day.
Status quo.
I wouldn't go crazy with hydration, but I also wouldn't stop hydrating either, because you're going to see different, like an orthostatic hypotension, because you don't have enough blood volume, and then you're dehydrated, and then that muddies the waters. And sometimes people are misdiagnosed with that instead of POTS. So really just afterwards hitting all your tricks, or, hopefully by listening to the podcast, you have like a bag of tricks now, and really doing that after, and just know that you got to ride this weather.
Yeah, it's going to be bumpy.
Now, the other piece that I did not have is some patients have been either given or been offered to use nitro. So they inject nitro to mimic the response. I have not heard nice stories about that. I'm not sure personally that would have been something I did. Who's to say? I don't know. But that I don't have specific experience with that, but that is something else you will see.
That's
people
out
say,
there.
Did you get nitro? And no, it wasn't even on the table, but some do.
So something to discuss with whoever's prescribing you that tilt test or ordering for you. Like, what are the benefits? What are the risks?
Yeah,
of
is it
doing
going to
it?
include that? What is it going to look like? And I just think, you don't want to like Google the heck out of everything,
Right.
but I also think being prepared of like, hey, this is what's going to happen. This is what it's going to look like. I'm not so sure if I would have Googled like tilt table if I would have seen the after effects, but hopefully by listening you'll know like it's okay and it's normal
That you're gonna feel pretty crappy.
there are some people now in the program that absolutely refuse the tilt table, and I don't blame them.
Yeah. They've heard the stories and they're not interested in doing it
because
themselves.
A lot of people that have this response, they're just like, why? I mean, I check every other box. I fit the POTS criteria in every other way. And what that criteria is, they've done things in office, like the NASA lean test, or they've done the poor man's tilt, documented more than once in front of a physician. EKG's negative, echo's negative, everything else is negative.
Rolled out the serious.
Roll out all the craziness and have been able to roll in plus your log of symptoms with the vitals of the different tests in office, and then people will be diagnosed that way. So I think that's probably more of like a provider type thing.
Sure.
But I also don't blame them for not getting it because...
Yeah, because if they don't have to, and you don't have... If your provider has enough other data points to say, okay, we're going to give you this diagnosis without that.
Yeah.
I mean, I would say skip it if it's going to make you feel bad. If you can.
I mean, it is. It was a horrible feeling. And I mean, I get it. And it's also the other part of people listening that I've had many people say, listen, I don't want to do the tilt. I have I just have no interest in it, but then my doctor won't diagnose me without it. What should I do? What I say to that is possibly find another physician.
Yeah.
My cardiologist that I follow with now is not the cardiologist I started with. So, I think you have to find the right team that it makes sense.
Oh, for sure.
And somebody who understands POTS, not just has heard of POTS.
Yep.
And I would say most times there is somebody who, with all the right data points, like Britt said, will help you be able to come up with the correct diagnosis, even without the tilt.
And it's okay to shop around too, like you said, with different doctors, because not everyone's an expert in everything. They can't be. It's just not realistic. Even in PT, you're not an expert in all things PT. You go into like a specialty state with nutrition. You focus, people that focus on pediatrics. It's very, they're not also counseling across a lifespan. So it makes sense that maybe you have a general practitioner like your PCP that is there to help you, but then you do maybe need to find someone that has a little bit more expertise in the certain disease that you have.
I've even seen it the opposite, where like, we don't love our cardiologist, but the PCP is really a great quarterback of care. So you're right. Like, and it's the personality that has to fit for you. I mean, it has to be the right fit, but I don't want people to be like, there's not a tilt table in our area, I'm never going to get diagnosed. It shouldn't be like that.
Yeah.
It should not be like that. There's still other ways. I understand that the tilt table is the gold standard, in terms of medical standards. However, we are seeing people getting a diagnosis in different ways.
Yeah. I've heard that like you date your doctors, you don't marry them.
Yes.
You date them because then you can try a couple of different ones to see what really is the best fit for you at the end.
Right. Because it's all about whether you have the gold standard of the tilt table, you do poor man's tilt at home, and you're taking that data to your physicians or the NASA lean. There are different ways to gather your data points and take everything and meet with the physician. And that the ultimate goal is, okay, we have the diagnosis, but it can't stop there, right?
Right.
That's the diagnosis part. We have a name to it. And I will tell you, I thought when that doctor got out his phone to message my provider, I thought, POTS, great, I have an answer. That lasted for like 5 minutes, because then when I realized I had no idea what to do with a POTS diagnosis.
Right. What does this mean?
It leaves quickly. So that is where, yes, we have the diagnosis, but you got to focus on like phase 2 of what is it going to be more than hydration, compression, spend time in each position.
We
need more. So that is where hopefully, the Pots Life comes in and gives you hope, whether it's through the podcast or through our program and the support that we provide there. You need phase 2. You get the stamp of approval in terms of diagnosis, and then it's like, okay, now what?
Like with anything, any diagnosis you get, okay, then there's the next steps. What do I do to live with this? Now that I have a diagnosis, and then there's part 3, right? Once you've kind of weathered that in between, now you're thriving in this, but you still had to go through the diagnosis,
1000%.
the learning phase, we'll call it, and then, just living life.
Yeah, living life. I told somebody today who was joining the program, I said, listen, I would be lying if I didn't tell you that I still had this healthy but scary fear. I never want to go back there. I never want to be crawling up my steps. I never want to feel as low as I did that first day. And you're right. So you have to have a plan at all different phases. I still now, even almost 5 years out, have a plan at this phase. I still do it. And it still keeps me maintaining a life that I didn't even know was possible because I was living so terribly. But what else? What other?
You didn't have no other option. Yeah. There was no other option at that time. And like we say 100 times on here, we'll say it 100 times more. Once you're done with the learning phase, it's a lifestyle change. 1000%. So it's just something that you build into your life. Like you get up in the morning and you brush your teeth. It's a lifestyle phase.
Correct.
It just becomes second nature. You're not overthinking it or thinking about it as much. It just happens.
It just happens. And as your symptoms improve and things come down, that lifestyle management just goes up in terms of it just becomes automatic. You start living, you start becoming I say all the time, like a normal human, right? You start becoming a human again, and then it allows everything else to come down symptom wise, and it just becomes part of your routine. And we have hiccups for sure, but the ultimate goal is we get the diagnosis, however that looks. We come up with a plan. Hopefully it's the Pots Life. We get you moving, and then we get you to a point where you are living your life, not just surviving anymore. We want to get you back to living.
You're back on those Disney trips.
Yeah. And living well on the Disney trips.
And enjoying it, getting out there, and the heat's not too much. All of that. All of that good stuff. So hopefully this provided a little bit of insight about what is this tilt table test? What does it mean? How to prepare-ish, some guidance, and what it's going to look like after.
Yes, hopefully it just gave you a better idea. I mean, it's sometimes people haven't even heard of the tilt or what it entails, or I just hope, the goal is that I hope you are prepared more than I was for something like this. And then, that you feel supported in your decision in terms of what your next steps are.
Yeah, and then once you get that tilt test, make sure that you're following those tips and tricks that we've talked about, the hydration, electrolytes, moving your body, eating at, appropriate intervals after to help try to decrease some of those symptoms that you'll have that are going to happen after that test, because they're basically taking you from 0 to 100 in that space.
In a very short amount of time, for sure. So just weather the storm. It can be done, and we're here to support you along the way.
Don't forget to like, subscribe, follow us on YouTube. We're on all of your major streaming platforms, and join us next time.
Yeah, we'll see you next time. Bye.